Hello, everyone. Welcome to DataKind's webinar today on digital tools for information and training and learning. Please introduce yourselves by typing into the chat with what organization you are and where you're joining from. We're excited to have everybody here today, and we'll get started in the actual program in just a moment. Before we start, just a couple of notes that I'd like to give to everyone. We are live streaming this webinar on LinkedIn and recording the webinar so that we'll be able to provide it to attendees after. So just so everybody's aware of that. And if you are joining us from Zoom, what we'd like you to do is to use the Q&A icon so that you can, at the bottom of the screen, so that you can provide questions for us, and toward the end of the program we'll move to try to answer as many of them as we can. So we'll get started in just a moment. Give folks a moment to join, and then we'll jump into the program. Okay, we're about to go ahead and get started. Just one more time, I'll remind everyone to please, in the chat, put your name and your organization that you're joining from. And also, if you would please use the Q&A function so that we can follow through and have your questions collected and then answer them toward the end of the webinar. So, hello again. Very excited to have everybody here for our digital tools for information and learning session. I'm also very excited to be joined by a few wonderful folks. I'll introduce them in a few moments, but we've got, just to give you their names, we've got Peter Otieno from OMREF and Alex Fulcher from Viamo. And what I'm really interested in talking about today quite a bit is this idea of the spread of these digital information tools. We can go back up one slide to the DataKind slide. So we're going to talk about these this information and learning tools. And as there are so many platforms that have been proliferated over the last number of years, one of the things that has become really key is that it's hard to track behavior change on platforms. And as we start to look at this voice recognition way of learning through listening, basically, which we'll talk about IVR in a moment, it's critically important that we follow that learning through to behavior change. So I'll jump back into those topics in a moment. But for now, this webinar is being hosted by DataKind, and so my name is John Harnisher. I am the head of research at DataKind, and I'm very excited to be hosting this and to have all of you with us. DataKind's goal is harnessing the power of data science and AI in the service of humanity. So what we are is a global nonprofit organization, and our mission is to bring data science and AI, machine learning to social impact organizations and to other nonprofits. We do that by bringing services that we provide pro bono that are supported by philanthropy to visionary change makers that are designing innovations across many different organizations and solving different problems throughout the world. And we help these mission-driven organizations unlock their data science potential. And it's very important for us that we do those things responsibly, that we do those things ethically, and that we allow the power of data science, machine learning, and AI to be brought to organizations that may not have as much data science capacity as possible, may not have data science teams, for example. So we bring that that capacity and that capability, and allow the data that those organizations are already collecting to become a catalyst to move the mission forward. Okay, we can go to the next slide. So today, what we're going to be talking about is I'm just going to do a very quick welcome and introduction to DataKind. Talk a little bit about interactive voice recognition, which is really the topic of the day, and what that is, why it's important, particularly in the social realm that DataKind works, and why it's so important given the reach that it has, which reaches sort of a demographic in the low and middle income countries that I think is really, really important, and still will continue to be important over the next several years at least. I'll then turn it over to Alex to give a brief for Viamo, and then Peter will give a brief on AMREF and give kind of a little bit of a how is this technology used, what kind of challenges do each of you see in that space. And then we'll move into our panel discussion, where I'll ask each of our two panelists a set of questions in this important area. We'll then move hopefully to be able to answer some questions from the audience that we have here, from the people who have joined us live, and then we'll do a little bit of a closing. So that is our goal for today and our agenda, and we can go ahead on to the next slide. So the objectives, what we'd like everyone to sort of leave here with, is to learn a little bit about what IVR is, how mobile learning works, and what those capacities are, and how you might use them or be involved in them in your own organizations. We'll give a few examples of how this is being applied today, provided by each of our two wonderful panel members. Talk a bit about the difficulty in tracking learning effectiveness and impact, right? So that component of behavior change when projects, when products, when content is created, following that through to seeing whether we've got an actual change in behavior can sometimes be difficult, especially given the data systems that we have available, the analytic frameworks that we have available. So interesting kind of part of the conversation that I definitely want to have about what can we do to reduce that difficulty, and how can we move forward to understand learning impact, learning effectiveness, and behavioral change from providing users with information. And then a little bit about what's next in the area, what's coming up, what are changes that are going on, what are things that we expect to see in the future as we move into all the changes that are happening in the world of data and especially AI, for example, right? There's a lot that's happening in AI that would potentially impact things like generation of content for interactive voice recognition and other content-related programs and projects. So today, so I am John Harnisher. I am the head of research at DataKind. Had a long career in data science. Largely spent the last several years working in the world of data science as it relates to education and AI and product development as it relates to learning and learning change in the world of higher education and K-12. And now I'm very excited to be working in a more broad realm as the head of research here at DataKind with all of the different impact practices that we have. With me, I have Alex Fulcher, who is the director of product management at Viamo. He's been working there since 2021. Alex specializes in data as a product. So the data itself is the product, delivering actionable data and insights in the form of dashboards. He uses the data to improve the experience of Viamo and for Viamo's users. Alex is based in the UK, has worked for in the ICT for development sector since 2011. He's built chatbots, Android apps. He's worked on CMSs, mobile websites, and designed designs for feature phones across Africa and Asia. So he's clearly got a lot of experience in this space. And so welcome, welcome, Alex. You want to say hello, Alex, for just a quick second before I go to Peter?
Yeah. Hi, everybody. Glad to be here. Thank you very much, John, for having me and having Biamo.
And then we have Peter Otieno. Peter has a background in innovation and social entrepreneurship with experience in scaling up technically driven solutions in various markets in Africa. He's worked extensively creating the Leap learning platform, which we'll talk about briefly today, and Mjali digital data platform. He's held roles in AMREF, including the digital health and technology-driven management projects. He's worked in partnership with public sector entities, corporate bodies, and regulatory bodies as well. He's a member of the Chartered Institute for IT and has contributed to the development of the National Digital Health Strategy in Kenya. He serves on expert panels for digital health and working in low and middle income countries through many different projects, including work conducted by the Novartis Foundation. So appreciate you as well, Peter, and we'll give you a chance to just say a quick hello, and then we'll keep moving forward.
Thanks, John. Hi, everyone. Looking forward to having a very engaging discussion through this exciting initiative.
So DataKind, we work globally. We have our headquarters in New York City, but we have chapters in Bengaluru, San Francisco, Singapore, the United Kingdom, and Washington, D.C. And our projects, as you can see, revolve around the globe. We've been doing a lot of work in the global south related to the IVR work that I'm about to talk about, and are really trying to, in all of these places, make sure we're bringing data science to bear in a way that is responsible, ethical, and is driven in a way where we are designing our solutions and our projects with those folks who are going to be affected with them and not for them. So designing together is our major principle, and we're excited to be working on these many projects that are having a positive impact. DataKind is also interested in dealing with wicked problems, okay? Problems that are relatively large. We're not only dealing with simple problems, right? A wicked problem is a problem that's difficult or impossible to solve because of incomplete, contradictory, and changing requirements that are often difficult to recognize. So trying to work to get all of those requirements, to tie down a solution is a really important thing for us, and we do not shy away from tackling large problems. And that's our philosophical way of working. It's our daily way of working as an organization. We have a very specific set of components that lead to a high impact data science and AI solutions for good. We develop and execute projects with a goal of globally valuable solutions. And we need to identify a set of components that allow us to get at those components and those solutions to realize our vision. So we are really dedicated to making sure we have a strong problem statement for any project that we work on. What is it that we're trying to solve? What is the pain point that we're trying to look at? And how do we move that forward? Can data science move that forward? We then need to obviously work with the data sets that are available and make sure we understand the data sets and the data itself really well. We bring the data science, either in-house data science talent or sometimes volunteer data talent to bear on the projects. We obviously need to get funded. We are philanthropically funded as an organization. But really important, two pieces that DataKind, I think, is very dedicated to and makes us unique, or at least keeps us grounded, are to make sure we've got the subject matter experts and the social actors and those local influences who understand where what the problem is, what the project is, and to help them to move the project forward. Okay. So far to date, we've been in business. We've been in existence for over 10 years. We've got 20,000 community members worldwide. We have 5 chapters in 4 different countries. We've had chapter applications from 40 plus global cities. We've held over 250 events. Our volunteers come from 174 countries. Very proud to have completed 350 projects thus far with 186 organizations. 239,000 hours donated, which is about $35 million in pro bono services. So we're very excited about the reach that we've had. So I want to talk about IVR a little bit and why it's so important. We can go to the next slide. Interactive voice recognition is a technology that enables computers to interact with humans through the use of voice and touch tone inputs via a telephone. This system can be used to provide automated responses to callers or to gather information from them by asking questions and recording their responses. And all of us have had, well, many of us have at least had the experience of using IVR in making calls to customer service. That's the sort of the typical instance of IVR. We're going to talk about some unique uses today, but that capability of having your path changed based upon what you say or based upon what you press on the telephone keyboard is kind of the navigation within an IVR system. IVR remains popular due to its ability to enhance communication, improve service, and disseminate information quickly. In this world where the trust of information is becoming more and more important all the time, and making sure that we've got solid and strong backing in our strong belief in the information that we're looking at, IVR is really critical in that space. You can go to the next slide. The reason that IVR is so important for social impact organizations and for organizations like the ones that we have with us today, basic phones, such as flip phones or feature phones, are generally the most common type of mobile device in many parts of the world, including sub-Saharan Africa. So in order to reach folks in that space who may not have a smartphone or will not have other devices and may only have a basic phone, which only allows essentially for voice interaction, you can provide learning to those people, you can provide information to those people, you can provide health information to those folks. So there are hundreds of millions of messages are listened by millions of users in this area. Mobile phones and smartphones have become more common across much of sub-Saharan Africa, but there are still important educational, financial, and generational divides in the ownership. And so the way that we are going to be able to influence folks is going to change based upon those differences as well. There's big educational gaps still for smartphone ownership. And in many countries, the fact that these gaps exist will seem to indicate that undereducated groups may need to use voice-based technologies, that they may be the only way to reach some of those groups. Another important component here is that lower education and literacy rates for feature phone ownership may be associated with easier consumption of information in terms of learning by voice. So interactive voice recognition has the potential to improve learning outcomes and expand access to education and training. Right now, again, this is back to that reach, the ability to get to people that you wouldn't otherwise be able to get to without this technology. It's also very personalized. So that's important in settings where access to a teacher, access to a mentor, access to access to another human might not be available, but real-time feedback, by getting real-time feedback, learners can receive guidance and support that can help them master new skills or concepts effectively. Information provided by IVR needs to be credible and timely. This is back to that trust of information piece. And IVR as a social behavioral change agent has seen some positive results. One thing that's important to keep in mind is that IVR is seen more as a replacement for broadcast things like radio than really for smartphones or for computers. And we'll talk about that in a moment as well. And lastly, linking mobile learning to outcomes remains critical. Connecting platform learning to behavioral outcomes is not easy to do. It's crucial to determine the platform efficacy. Are all of this content that we're putting together, all this information that we're creating, all of these experiences that we're giving, are they actually having an effect on change in terms of learning? Mobile learning experiences that are self-directed, informal, and personally guided tend to work better than those that aren't. Learning characteristics like this, being personalized, being directed to the needs that people are looking for right now, are becoming increasingly important. And practice-based learning as much as possible, giving something that's timely and able to be practiced right away, is really important. Also, last piece is that interactive voice recognition breaks information into consumable small chunks that are more easily understood and do not overload the cognitive capacity of learners. One of the things that's happening as a trend in education altogether is this shrinking of the size of learning components. That's really important. Okay, so I will turn it over to Alex to give us a little bit of an overview of what's going on at VIAMO.
Thank you, John. And hi again, everybody. Let me introduce to you the OC is the persona that we use at the center of our design. And we can explain our problem statement that we work towards. OC isn't online. She's isolated. She's lacking access to on-demand information, products, and services. And the development sector's partners that we work with at VIAMO have difficulty engaging with her. When her child is sick, OC can't pull information out of her radio, nor can farmers who need to know when it will rain, shopkeepers who need a small loan, or else community health volunteers who need help diagnosing a patient. And what we know in the sector that we work is that OC is not by any stretch of the imagination alone. There are 2.7 billion underconnected people in the world just like her. Half of the world's digital population is disconnected from the digital economy, and that's not going to change anytime soon. And this means that we're not on track to reach the SDGs by 2030. But what we do know about OC is that she has two superpowers. She's saved her money to be able to purchase a SIM card and a simple mobile phone. This would have been most probably the first electronic device in her house. We also know that her desire to connect with the outside world is very, very strong, just as it is for everybody. And she's able to combine those to be able to use her phone to get access to the things that she needs. And what we've tried to create at VIAMO is a platform which helps her to gain access to all of the information and services that she needs. The VIAMO platform is an opportunity for OC to meet the type of partners that operate in the sector that we can see on the right-hand side of this visualization, along all variety of different subject areas, based on the things at the heart of her own needs, in her daily life experience. We try to create the best opportunities from our partners for OC and present them in a way that lets her pick what she needs when she needs it, making sure that we're able to help overcome the key problem here related to access, fragmentation, and discovery. And we're working across Africa and Asia, I think in 22 countries at the moment, to provide this type of platform experience in line with our partners at telcos who help us to provide reach to millions of users. Thank you.
Yeah, thanks, Alex. So let me jump in and give an overview of AMREF Health Africa. AMREF Health Africa is one of the largest NGOs in Africa, and we've been in existence since 1957. with 8 African countries where we have a physical presence. But I must say that one of the other things that we've done over the years is that we've trained quite a large number of people from the primary healthcare sector right up to policymakers across 35 African countries across different subjects, looking at leadership management and governance, health system strengthening, and also public health topics. Our overall vision is lasting health change in Africa, and we've had a reach of over 110 million people with a focus on women and children. Some of the SDGs that we do track quite naturally are SDG 3, which looks at health and well-being, gender equality, and also looking at achievement of the other SDGs. In terms of human resources for health, we have a university that has a focus on training different cadres of health workers. You have community health workers who are the front-facing aspect of health for most communities globally. And you also have higher cadres of health workers such as nurses, doctors, clinical officers. And through this approach, we do offer e-learning courses and mobile learning courses, and also blended learning courses. The next slide. So one of the platforms that we have is called LEAP. And if you look at LEAP, we started this platform to be able to address some of the challenges that are faced in primary healthcare. If you look at training community health workers, there are very many challenges around the uniform nature in which they learn, challenges around career progression, and also challenges around tracking their learning progress. So over the years, we've trained 168,000 community health workers across 8 countries, and we essentially use this platform to deliver harmonized curricula and also resist epidemics and pandemics. Over to the next slide. I don't know whether you've heard or anyone else. Maybe we can move to the next slide. Okay, perfect. So if you look at the platform to date, in terms of reach, we've touched close to 3.5 million households. If you look at Kenya specifically, with an initiative that we ran with DataKind, one of the things that we did was an analysis on 35,000 community health workers trained in Kenya. And part of what we're validating is training data that we had was predominantly anecdotal, but there was a lot of questions of where is the real evidence in terms of what are the training outcomes in the health system? Are people able to deliver better within service delivery? And how are we able to touch on that impact? Next slide. So some of the key findings based on this is that there have been increased referrals after community health workers have gone through LEAP training, and this is after doing linkages between LEAP and the other platform that John mentioned, which is called Mjali. So Mjali is a data collection platform that has digitized Ministry of Health tools and enables us to see what the community health worker who has been trained translates to in terms of the service delivery aspect. We also found that completion rates for digital learning are quite good. If you look at the global rates, it's estimated to be around 10%. But one of our key findings within LEAP is that they are around 38%, which shows quite some good findings. However, we also have some areas of improvement with the DataKind team, which we'll delve into further as we proceed on with the discussion. But one of the other interesting findings was that learning on its own does not have good outcomes. It has to be within a structured program. And when we talk about structured programs, we're talking about programs that deal with a particular thematic area, such as reproductive, maternal and neonatal child health, such as NCDs, where the people who go through a training are able to quickly translate what they've learned in some practice area that can be quickly tracked within the wider health ecosystem. We also found that within the 3 learning aspects of a LEAP topic, which are the content, quiz, and the practicum is the most common platform activity. And again, this goes to show that people are more geared towards microlearning as opposed to heavy content that might not be very relevant to them. And one of our last findings was around scores and completion rates. And what we found here is that people who go through English are more likely to perform better than people who choose Swahili as another language. And I think this has also helped us to understand that people who do not take English will require more support. I think this was the last slide. I don't know that there's any other slide after that, and maybe I can hand over back to John.
Thank you, Peter. Yeah, that was the last slide for you. I really appreciate that. I think, you know, I'll start the panel discussion with you, Peter, because I think we've got we can continue from what you've just been saying. Some of the interesting things I think in that space around, you know, learning outcomes from a platform that includes a lot of you know, verbally created learning, you know, listening in terms of learning as LEAP does. It's very interesting, this interplay between structure and sort of choice, right? Because if you allow folks to have a lot of choice, they'll be learning what they want to learn, and they'll, you know, be guiding the experience toward the information that they seek. And that may not be exactly the information that is along a structured path that you would want them to follow. So starting off, I thought maybe we could jump into that interplay a little bit and how you think about that in the platform that you're working on.
Yep. Thanks, John. So I think if you look at some of the ways the topic is structured, and sorry, I may have dropped off a short while ago, but we have what is referred to as a learning chain within a LEAP topic, which looks at 5 core pillars, which is engagement that introduces a topic to the learner. You have an aspect of knowledge sharing, where a learner goes out to a particular community, carries out a task and comes back and reports to their learning cohort. Then you have an aspect that also looks at application. How are they able to translate what they've learned theoretically into a practical manner, which is followed by reinforcement, which is a summative part of the topic. And finally, rewarding, because it becomes very frustrating for you to go through any form of learning, but you do not get a form of recognition, which can be certification, or it can even be basically getting a score that shows on a leaderboard. But I think one of the key things that becomes very important is how do we ensure that learning does not become boring? And basically, it's looking at breaking down the learning into micro-learning that is manageable by different kind of community health workers or even health workers. And in this way, now you're able to track where they have issues with their learning, where they need supportive supervision, and also figuring out whether the content needs to be reworked on. We've had instances where we rolled out content that was very technical and we got feedback, and which enabled us to make it more palatable to the community health workers.
Excellent, thanks, Peter. Alex, I'm going to jump to you for a question. So, as learning and informational platforms continue to add new features and updates, how do you know the platform behaviors are having an impact on, on learning or behavior outcome? How do you know that what you're providing is really linked to change?
Yeah, so I guess before even being able to answer that question, we actually have a more kind of formative issue that we have to deal with when working with IVR. Over the years, the VRMO platform has amassed an incredibly rich data set. Our platform is available at scale in the countries we work in, and I think since 2015 we've processed nearly 1 billion calls. What we have as a result of this is a challenge related to big data, which we see quite often, but a problem related to it as well is potentially a lack of interest from the big organizations that work in technology as a whole. There's simply no off-the-shelf measurement service for IVR engagement. You think of something like Google Analytics or Facebook Analytics. You have the tools available to be able to immediately understand what's happening. You have metrics available which tell you what success should look like for you. I think those simply don't exist in the world of IVR. So we have to create that first of all. And then second of all, we actually have to create the tools to be able to give our team and give ourselves as an organization the ability to monitor what is happening within these services, identify the key points where people may be having issues, and then be able to build something better, to really create that test and learn cycle that creates great products. We've created our own underlying data sets and pipelines, and we've created dashboards in order to be able to do this using our own bespoke metrics for success. So that gives us the base that we need in order to be able to address more complex engagement. I think that's the key thing. We want people to come back over an extended period of time. People only have a limited amount of time they can spend in one sitting, and that probably doesn't represent the engagement that's needed to really move the needle in terms of providing some kind of impact. In order to do that, we need more complex features. Digital training is a great example and is something that VRMO does as well, with the type of users that Peter was describing, but also now on our platform itself at scale. And we need to be able, whatever we do, to make sure that people can use that service, that there's no frustration in the use of that service. We know where those points are, and we can see how we can encourage return usage, but also understand exactly what those data points are that represent successful engagement, completing a lesson, completing a number of lessons, how long it takes to do that, how many sessions it takes for them to complete that. And so, well-designed features can be added and are being added because we want to make sure there's a rich, interactive, compelling experience for the people that use our services via IVR. But we always have to make sure at the heart of that there's a approach to measurement that we can take up that allows us to scale those, because I think, again, as Peter was saying, we need to move beyond just the kind of anecdotal towards the kind of tangible.
Yeah, that's great, and it is important, for us at DataKind to think about a data scienceable issue that might exist, or how does data science and come to bear to propel things forward in that space. And this idea that in both of these sorts of use cases for the platforms, there aren't already created off-the-shelf, there isn't a lot of attention already given to this. So there is a need for data science, for dashboarding, for getting in and analyzing and looking at just even the what's happening in terms of usage of the platform. How are we getting people to return to that space before you can then even begin to move into looking at the impact in terms of learning, in terms of outcomes. So that's a really good point. One other question I had, and I guess I'll go back to Peter. What new methods are you using that informs your next set of platform features? Like, what have you learned? You already mentioned micro-learning, but other things that might be implemented as you are moving this platform forward.
I think that's a good question. And, you know, if you look at global trends, one of the things that is going to clearly change the world is artificial intelligence. And it becomes a question of how will we use artificial intelligence within the digital health tools that we have. We definitely know that we need to start building modeling tools that enable us understand our learners better. And you know, one of the things that I always say is that without understanding someone's digital profile, there can be no digital transformation. So we already do have a digital profile of learners, and it's a question of seeing what is it that our learners do in terms of behavior. We have some very interesting dashboards that we worked on with DataKind that show us that most people actively learn on Wednesdays. And by a topic being deployed on Wednesdays, most learners again engage with topics between 4 to 10 p.m. or 4 to 2 a.m. So you see, our current approach has been looking at deploying topics within the day, which means that now we have to rethink and test with this new data that we have to see if we provided help desk support between 4 to 2 a.m. Would it translate into better performance? And also looking at now the service delivery aspect. When we deploy disease surveillance tools, are we able to predict a future pandemic or epidemic through syndromic disease surveillance? Are we able also to track whether the quality of data that a particular community health worker is collecting will be good or not, so that we can put in proper supporting mechanisms? So I would say these are some of the things around artificial intelligence, and then also looking at the transition from legacy systems to having an analytics platform that is able to pull data from all systems into richer dashboards and data sets that can be able to provide policymakers with good decision-making tools.
That's great, and I'm going to pass that same question to Alex in a moment. But I do, DataKind is obviously very involved in the world of artificial intelligence and has been, been thinking about how we could provide advice and learning as we have many partners who are at different stages of using AI. And from a webinar that hosted with our head of data science last month, we came to a couple of conclusions, which I think are probably still very true in this space. And one is to probably go slowly, to not necessarily rush, and especially when we're dealing with the critical topic of health that we're talking about here, in both cases really critical topics. So go slowly is sort of one piece of advice that we think is relatively easy to give, and also this notion of keeping human validation involved right now, as we all understand some of the issues that exist with AI at the moment. We would want to make sure that that's the case. But I think it's a really important idea, Peter, to think about how how all organizations are going to figure out bringing that component into the ecosystem. We'll talk about it for content maybe in a moment as well. But let me give Alex that first question about new methods that you're using to inform platform changes. Go ahead, Alex.
Great. Yeah, so we're working closely with DataKind at the moment as well, as part of a grant which we've recently received from the Bill and Melinda Gates Foundation. The goal is to better understand the lifetime experience of our users and how we can create a more long-lasting personal user experience, which will lead to the uptake of real-world services such as family planning, with a particular focus on the experience of our female users who are often marginalized by technology in the countries where we work. Our goal and our thought is the more personalized, relevant, and timely the service is, the more changing it is to the needs of the end user. the more likely that the user will continue to engage as they're seeing something that changes with them based on needs that they have, and hopefully needs that we can predict on behalf of that user. But a key part of that, and where the project lies with DataKind at the moment, is understanding what a lifetime engagement looks like for our users. They obviously they come here for the first time, they come to use our platform, they listen to a number of calls over time, and eventually, hopefully not, but it will always happen. There will be a last call that somebody makes where finally they decide that the platform isn't for them anymore. And so, there's a huge number of interactions that occur in between all of this. And, we may see a kind of steady use of the service until finally that user drops off. We may see a decline in their usage, and there may be key things that happen which cause frustration in the service, or which may lead to a point where it seems like there's lack of interest. And we want to be able to map exactly what that looks like for our users, understand them in terms of segments, based on information that we collect about them, which our users share with us, to see exactly where we can put that just-in-time information to help continue users having a enjoyable, relevant, and impactful experience with us that leads to the real-world outcomes that us and our partners want to create.
Great, thanks, Alex. Another thing that I was just thinking about when we were talking through this notion of AI, and especially all the work about generative AI, what do you think specifically might be the role in the future for generating content on each of your platforms using AI? And what do you think your plan might be to bring that to bear? I don't know who wants to go first. I'll let you, Alex, if you want to jump back in, you can go first.
Sure. Yeah, no problem. I mean, it's incredibly exciting to see the speed of progress in this field, and I'm sure everybody who's used ChatGPT or DALL-E or another similar tool can see the amazing potential to be able to create content in a very quick amount of time, and to be able to iterate on it and create the groundwork for something that's truly engaging and captivating for users. But I think we have to go back to John, what you said. We're working in very specific areas which have a lot of danger factors associated in it, and key to providing the services we do, both for Viamo as a platform provider and for our partners who provide the content, is maintaining trust at all times. So making sure that our partners, who are the ones with the subject specialism that we work with, are the gatekeepers, the validators of the meaningfulness of the content, is going to be really, really important. And I love the idea in principle of artificial intelligence being used as an assistant, like to us as in a creative fashion, to be able to iterate, come up with different ideas for what things should be like. But I feel it's very, very important in the world that we live for there to be experts involved to ensure the quality of what is being created, and to ensure the safety of users as well. I think quality of content is really at the forefront of everything that we want to do, because why would our users use these services if it wasn't for that quality? And to think that we can kind of palm off the work somehow, and whilst ensuring that it's giving the right information, I feel like that's not something that we can immediately do, but there's incredible potential related to what we can do and how it can improve the process. So very excited, and obviously thinking a lot about how we do exactly this exercise.
Yeah, and I'll throw it to Peter too, but that notion of trust that you mentioned, Alex, I think has become even more critical as we've had there's been a sort of a loss of trust in a lot of sources of information in the last few years, And then particularly knowing that when AI is involved, there could be systematic reasons why you would want to be even more concerned about trust in that space. And so I'm sure, in both of the instances and use cases that you have, trust is critical. Peter, any comments there?
Yeah, I think for me, I'd look at AI more as an enabler as opposed to a content provider. And when I say an enabler, it would be looking at assisting learning. So for example, I think you've seen when you go through LinkedIn Learning, it's able to look at your core capabilities or skills, and it recommends specific courses for you based on what people are learning globally on the same role. But I would also say that it would be an enabler in terms of prompting possible content for people to learn. If there's a cholera outbreak and, it's looking at a lot of people are talking about cholera, it prompts you and says, should you be now deploying cholera content in this particular county, province, or district? So I would say that for me, I see it more as being an enabler to prompt people to create specific content based on trends that have been looked at, or even topics that people are discussing based on feedback that has been provided in surveys. But I wouldn't say that for health, it would be a content creator yet. There might be a time when it will become a trusted content creator. But in these formative stages, I would be quite cautious with that approach.
Yeah, absolutely. Absolutely. That makes complete sense to me. It's always interesting to think about the inherent value of the way that learning or information is presented. And it does seem that there are a few of these in the platforms that you're using that we should take advantage of as they become even more important, and more is learned about that in the outside world. So, a few that come to mind is that the information should be as localized as possible, right? So the ability to have something in someone's local language, for the information to be just in time, for, as Peter mentioned, a cholera outbreak, to discuss the cholera outbreak right then and there. And so to be as as timely as possible and available in a local language. The other thing is, which we mentioned earlier on, is this idea of parsing the content down into a space that is digestible from a person taking that information in's perspective. So I'm wondering what changes you may be making, or what things you may be doing to make sure that this localization continues, and whether there are any new things coming down in terms of making that even more, even a more central piece of what you do. Peter, you want to start on that one?
Yes, thanks, John. So, I mean, I totally agree. One of the key findings that we've realized of late is that for the way we deploy our mobile learning topics is very academic. And that brings about specific challenges because, one, people essentially do just want to pass the topic because there's a pass mark that has been put there, but they miss the practical aspect of the learning. So you might find that there are very few people passing the topic, and that shows that completion rates may not be as expected. But then from a practical perspective, you do find that a lot of people are simply missing out on important parts of the content and going now to the practicum aspect, which is the last part of the topic that essentially has scenario-based learning. Now, looking at this, it has already made us realize that our topics need to focus more on scenario-based learning. These other aspects that we have been deploying initially may not be very relevant. And we need to now start figuring out, with the scenario-based learning, how do we complement it with things like decision trees, things like job aids, things that are more practical, within the health sector, as opposed to the theoretical aspect that was quite heavy initially. And I think even as we move forward, we've already started testing some micro-learning aspects in some of the new programming that we are doing, so that we can now see, are we going to have better performance in terms of the topics, but not only better performance, are we going to see a translation in the way community health workers carry out their jobs in the service delivery area? So those are some of the quick steps that we are going to take. And then as we progress on, we'll mature into more elaborate tests. Back to you, John.
Yeah, Alex, do you have any comments about sort of the complexity of content?
I guess something to add to it is related to, you know, working in the various languages that we do. You know, like there's amazing leaps and bounds made in translation at the moment, but I know, you know, from Viama's perspective, there are so many languages that we work with, which aren't the mainly used languages on the internet, and it's going to be still quite a long time, I think, before those languages are represented, and not just represented, but represented well enough to have a good service for our users. And I'm, you know, obviously always very concerned about the potential for technology to create a wider gap in terms of usage. And I think there's a danger that can happen with this type of big leap that occurs, where actually through the types of services we're creating and the use of IVR, which hopefully is able to bring more people and include more people into this process and engage them in more complex ways, that another leap can occur, which actually stops people from being able to participate as a result, you know, in this instance of language. As you know, like as the voice assistant becomes the kind of key way of interacting with technology, people may have to use, you know, like English, French, Spanish, Portuguese, you know, or maybe Swahili, you know, like it's happening, like to be able to do that. But that doesn't necessarily make the best, most relevant experience for people. And so, yeah, I think we just need to be very kind of cognizant about ensuring that whatever we do is based on like what is going to make a successful experience for the user, rather than what makes things easier as providers.
Absolutely. Yeah, so we're coming up on the hour. So I want to thank you both for sharing so many useful insights about what is going on now with these tools, and what is going to be coming in the near future in these tools. Anything that I didn't get a chance to ask you about, or any comments you'd like to make before we close in this last minute or two, I'll throw that to you, Peter.
Yeah, I think my part in short would just be that context is key. Alex touched on it earlier on. And without understanding the context in which you're deploying any of these digital tools, you're bound to fail. So it's very important to understand context from a cultural perspective, from an infrastructure perspective, and even from a policy perspective. Without having a good understanding of some of these issues, you'd essentially be building what we refer to in Kenya as a white elephant. And a white elephant is something that is grand, that basically has no possibility of scalability. So that is a very important point to focus on, even as different partners look to deploy digital tools across different countries. Back to you, John.
Great. Alex, any last thoughts?
Yeah, I think it's just with anything that is created in technology as a whole, ensuring, you know, like usability should always be at the center of it. Doesn't necessarily mean that things can't be complex, and I don't think we should patronize our users in terms of like what can be achieved, like even on most basic phones. I think the potential is amazing. At the same time, we should be wary of over-engineering the services we have, and any exciting new technology, you know, can cause that. But as long as we focus, you know, like primarily on the needs of our users and fulfilling those, and you know, the needs of our partners and the kind of data we collect, we should be able to make really great services, you know, irrespective of the type of technology that we use.
Great. Well, we've just come up on 11. I think we can share the poll that we wanted to give for folks who are departing. I really appreciate everyone's time and everyone's really great attention here. And thank you to Alex. Thank you to Peter. I'm sure we'll have further conversations about this in the future. And you know, DataKind is very excited to be in this space and to continue to learn, continue to grow, and continue to bring data science to help move the organizations and their missions forward. So thank you.
Thanks, everyone.
Thanks, everyone.